Dr. David Kulla, your New York City chiropractor, here with another case of hiatal hernia. So Margaret here, have we done videos with you before?
No.
No, okay, this is her first video. She's a newbie, but she has been here a total of 5 times. Today's her 6th visit. And she came in with really severe symptoms from hiatal hernia. I'm going to read you her progress, okay? She was in the hospital for a few months, so we saw her 2 times in June, and then, or 2 or 3 times in June, and then 2 times in September this month, because again, she was in the hospital for some other issues. Now, she has had her gallbladder removed, and there's a product by standard process called Collicol 2, and it's great for people that have had their gallbladder removed. It helps the bile salts move, and it's a necessity if you've had your gallbladder removed. So I'll give you the name of that and give you a prescription for that so you can go ahead and order that on your own, okay? But when she first came in, she was having constant hiatal hernia pain, stomach pain, bloating, acid reflux, shortness of breath, regurgitation of food. She labeled her acid reflux at an 8, her stomach pain and bloating at a 10 before she saw me, shortness of breath at a 6, regurgitation of food at a 10, and nausea at a 10. 10 is the highest amount of pain, 0 would be the lowest. So, you know, her stomach pain, her regurgitation of food, and nausea were at a 10. Her acid reflux an 8 and shortness of breath a 6. Now, after 5 treatments, which were spaced apart. So, you know, ultimately we would have loved to do them together, but things happen, life happens. And her acid reflux went down from an 8 to a 6. Her stomach bloating went down from a 10, and stomach pain went down from a 10 to a 7 now. Her shortness of breath only went down from a 6 to a 5. But the regurgitation of food went from a 10 down to a 5. So it's about 50% better. The nausea, she's still having. It's a 10 out of 10, just like before. So she also has irritable bowel syndrome, and the nausea could also be coming from some other things that we're going to dive into nutritionally with her. But today's video is a special one because we are going to give her this new tool that I created, a hiatal hernia hook, I call it, okay? So the hiatal hernia hook, we're going to teach her how to use it today. And she's going to take this for 2 weeks, use it, and we're going to follow up with her with the same questionnaire or similar questionnaire and just follow up with her in a couple weeks. So I'm going to show you guys how to use the new hiatal hernia hook. So we're going to just put a little dab of this Vaseline, or lotion would work just fine. I think lotion is probably a little better. Vaseline's a bit slippery. Okay, and I've told you guys how to find the stomach or the hiatal hernia. It's right near the xiphoid where the ribs come together, and just 2 fingers to the left. Okay, so just slightly to the left of your xiphoid process. Xiphoid spelled X-I-P-H-O-I-D. Okay, so I'm going to show you how to use this. So since your ribs go down at an angle like this, right, we're going to have you facing, see how this blade here is at an angle here to your ribs? We're going to have you eventually turn it this way. So through the motion, you're going to turn it this way. Okay, and then slide it straight down, okay? So what we want to do is we want to get underneath the ribs here. So let's go ahead and zoom in here so we can see a little better. Okay, so now you'll see here her xiphoid process. We want to go just 2 fingers to the left. And because her ribs go at an angle down, 45-degree angle down that way, the blade here is going to be at that angle. But she's going to take some deep breaths in and out. And with each exhalation, I want you to stick this blade here a little bit deeper, the applicator, a little bit deeper, and breathe. Yeah, I don't want you holding your breath, okay? In and out. And with each exhalation, as the stomach relaxes more, you're going to apply more pressure downward into the stomach. Okay, and see how I'm kind of going slightly under the ribs there? So what I want you to do is take your hand and put it where my hand is. Good. And you're going to apply that constant pressure. Breathe in and out. And it may take 30 seconds, it may take a minute for some people to really relax the stomach. And notice how the angle of this applicator, the stem, is facing at a 45-degree angle down towards the feet. There's a reason for that. We want to get that blade underneath here. I'm just going to pull this shirt up just a little bit here, okay? Okay, now breathe in and out, and on exhalation, you're going to slide down, but we want to maintain that constant pressure into the stomach. So you're going to keep applying that pressure there, right to the left of the xiphoid. Okay, and when you feel pulsating or a pulsation like a heartbeat, that's when I want you to stop. Okay, you can feel a tiny, slight pulse. That's okay, but I don't want you to keep pushing further beyond that. Okay? How are we doing there? And now take your other hand if you need to and apply it on top here. Yep. And you're going to apply pressure and keep it constant. And do you feel that pulsation yet? If not, you need to apply a little more pressure. Let me know when you feel it. Breathing in and out. Okay, now that you're relaxed, we're going to do a stroke down, but we're going to rotate the blade this way a little bit. There you go, and slide it down. Bring the ball of the handle towards your head and slide it down, maintaining that pressure. Okay, good. Now let's tuck your shirt under your bra there a little bit so it doesn't get in the way here. Great. Okay. So now we're going to do it again. We're going to find the xiphoid process right here in the center, and then we're going to go 2 fingers over from there, which is right there.
Right here on the ankle.
Yep, that's where we started. So now again, take your hands. Yep. Breathe in and out, apply pressure. Try to get all the way down. You'll feel a pulsation. If you can get down to that depth, great. It might take a few repetitions, a few slides down to get to that point to where you can push and get it deep enough to where you'll feel the pulsations. That pulsation is most likely your abdominal aorta, which is underneath or behind the stomach. So if you have a abdominal aortic aneurysm, this is contraindicated. You should not be doing this. You can have someone else doing it for you.
If I have a leak valve?
A leaky valve, that's fine. Okay. You're going to apply that pressure, breathing in and out. And you want to keep applying a little bit more pressure on each exhalation. Just gentle, light, increase that pressure. Again, till you feel that pulsation. You feel it there? Okay, now you're going to bring the ball of the handle up towards your head a little bit more. Twist it a little bit to slide it down. Good. Maintaining that pressure. Good. There you go. How'd you feel on that one? Did you feel any gas coming up or no? Okay. Does it feel as intense as when I do it with my hands?
No.
Not as intense as when I do it. Okay. Yeah, and you're going to have to get some practice, okay? So at that time, the last one, you felt that pulsation. So you want to go all the way up until that pulsation and then maintain that constant pressure, twist a little bit and pull it down. Maintaining that constant pressure. So both hands on top. Make sure that the stem is facing down towards your feet at a 45-degree angle like this. This way. Yep, there we go. Make sure you're not rotating it too much. No. Like that. Okay. Okay. Breathe in and out, applying a little bit more pressure each time. When you feel that pulsation, I'm going to have you slowly rotate the stem up towards your head this way and then twist it a little bit, maintaining that constant pressure. Yeah, twist it a little counterclockwise. Good. Slide it down. Maintain that pressure. Maintain that pressure. Okay. And one more. So you can do about 3 to 5 repetitions in one sitting. And you can do this daily. If your stomach's too sore, do it every other day, okay? And breathe in and out. Folks, you can't see this, but as she's exhaling, she's applying more and more pressure, just slight, like maybe adding a pound each time she exhales. What's that?
I feel the pulse.
You feel the pulse? Okay, now go ahead and bring the stem back towards the head and then rotate it a little bit and slide it down. Maintain that pressure. You might feel just a tiny pulse, but it shouldn't be too strong, okay? And if it's not sliding well, bring this back further. There you go, and it'll slide better. Yep, that's it. You did a great job. Okay, now I'm going to check your thoracic spine, you know, your mid-back, okay? So I'm going to have you turn over on your stomach. So I'm going to give you this to take home. We'll follow up with you and do another survey and questionnaire. And 2 weeks from now, okay? Now, a lot of people are asking, well, why am I adjusting her mid-back and her neck? Because the nerves at T6 through T9 go to the stomach, large and small intestines, and the diaphragm in the vagus nerve. Also, C3 through C5 in the neck, phrenic and vagus nerves, which control the stomach as well. So nerve supply to the stomach and diaphragm comes directly from those areas of the spine. So that's why we're treating those areas of the spine specifically. Take a deep breath in, bend your knees for me. Good, and blow all the way out. Good, and drop your legs down. Good, and relax here. Okay, and turn over on your back. So I think now that you're out of the hospital, now that we can get some regular hiatal hernia treatment, pulling it down, your results should really speed up here. You should see some significant changes here over the next few weeks, okay? Cross your arms in front of you. Give yourself a big hug. There we go. Tuck your chin down. Take a deep breath in, half a sit-up. Deep breath in. Good, and blow all the way out. Stay tucked. Okay, and one more. Come back up. Deep breath in. Good, and blow all the way out. All the way out. Good. Okay, good. You should have that lipoma right there checked out. Do you get any numbness or tingling in your right arm?
No.
That's a pretty big lipoma.
They say it's fatty tissue. I don't know where.
What's that?
They say it's fatty tissue in there.
Fatty tissue. Yeah, that's what a lipoma is. It's fat tissue. Yep. Well, just keep an eye on it. If it grows, it could cause some tingling or numbness in your hands. If that happens, let me know. Okay? All right, you're all set. Thank you.
Thank you so much.
You're welcome. So you'll take that tool home, use it every day, just 3 to 5 strokes each day. If it's sore, take that day off, use it the next day. Okay?
All right. Oh, okay.
Okay. Thanks for tuning in, everyone. If you guys have any questions or comments, feel free to comment below. I try to answer all the comments. So hang in there, be patient, but I will get to your comment. Thanks for tuning in. I hope you liked this video, and see you soon.